Oral nasal patch checkoff medication administration. Review MAR for the 5 rights.
And I have James Dilworth, and he will be getting Digoxin, 0.125 milligrams, orally once a day, and I'm giving the 8 o'clock dose. And then I'm also going to be giving to James Dilworth fluticasone, Flonase, nasal spray, 50 micrograms. I'm giving 1 spray each nostril daily at 8 a.m. And I'm also going to give James Dilworth his nitro patch, 0.3 milligrams per hour. I'm going to apply it in the morning and remove it HS, and that is also daily at 8 a.m.
Verify allergies.
He has no known allergies.
Research information about each medication. Gather equipment, gloves, correct medication, med cup, glass of water, straw.
Table.
Perform hand hygiene. Calculate and correctly prepare accurate dosage of each medication to be administered.
I have James Dilworth, 47212, 47212. All right, my first medicine is Digoxin. I have Digoxin, 0.125 milligrams. I have 0.125 milligrams. It is a tablet. I'm going to give it daily at 8 a.m. and I'm going to need to check his apical pulse. That's my first one. And then I also have, for James Dilworth, fluticasone, Flonase. I have fluticasone, Flonase. It's a nasal spray. I have a spray, 50 micrograms. I'm going to give 1 spray in each nostril daily at 8 a.m. And then I also have for James Dilworth, NitroDur patch. I have a NitroDur patch, 0.3 milligrams per hour, 0.3 milligrams per hour. I'm going to apply this in the morning and remove at HS at 8 a.m. And that's all I have. That's my first check. And then I'm going to go ahead and do my second check and make sure everything's prepared. James Dilworth, I'm going to give Digoxin at 0.125, and I have Digoxin 0.125 milligrams, so I don't need to do a calculation. It's orally. I have a tablet daily at 8 a.m. That's my second check. That one's done. Then I have James Dilworth. I'm going to give fluticasone, Flonase. James Dilworth, fluticasone, Flonase. Nasal spray, I have a nasal spray, 50 micrograms. I'm going to do 1 spray in each nostril daily at 8 a.m. And then I have James Dilworth, NitroDur patch. I have a NitroDur patch, 0.3 milligrams per hour, 0.3 milligrams per hour. I'm going to apply the patch in the morning and remove at HS at 8 a.m. My second check.
Administration of oral medication. Perform hand hygiene.
Okay, I'm going into the patient's room.
Introduce self and identify patient by 2 identifiers: name, date of birth, medical record number.
James Dilworth, MRN number. My name is Cheryl, and I'm going to be giving your oral meds and your Flonase nasal spray and your patch.
Provide for privacy. Conduct any necessary pre-administration assessment.
I'm going to go ahead and check an apical pulse. Apical pulse is 80, so I'm good to give his oral med.
Explain purpose of each medication to patient.
Okay, so I'm going to go ahead, and before I give anything, I'm going to do my third check. on my meds. So I have James Dilworth, and I've already verified that's James Dilworth. I have Digoxin, 0.125 milligrams, 0.125 milligrams. It's oral. I have a tablet. I'm giving it daily at 8 a.m. And then I have James Dilworth, which we verified. He is getting fluticasone Flonase nasal spray. And I have fluticasone Flonase nasal spray. 50 micrograms, 50 micrograms. One spray in each nostril daily at 8 a.m. And then I have his nitro patch for James Dilworth. Nitro patch 0.3 milligrams, nitro patch 0.3 milligrams. Apply daily in AM and remove at HS, and it's due at 8 a.m. And I'll put this on at 8 a.m.
Position patient correctly for oral medication to be swallowed.
Oral pill.
Administer medication as per patient's tolerance. Remain with client until oral medications are swallowed.
All right.
Nasal medication administration. Don clean gloves. Help the patient to a sitting or lying position with their head tilted backward or to the side if the drug needs to reach one or the other sinuses. Place a rolled towel or pillow beneath the neck if needed. Nasal drops. Remove the cap, aim the tip of the dropper toward the nasal passage, and squeeze in the number of drops prescribed. Instruct the client to breathe through the mouth as the drops are instilled. Nasal spray. Place the tip of the container just inside the nostril and occlude the other nostril. Instruct the client to inhale as the container is squeezed. Repeat in the opposite nostril if ordered. Advise the client to remain in position for approximately 5 minutes. Recap the container and replace where medications are stored. Application of medication patch. Remove gloves and don new clean gloves. Remove any old transdermal patches from the patient's skin. Fold the old patch in half with adhesive sides together and discard per facility policy. Gently wash the area where the old patch was with soap and water. Assess patient's skin where patch is to be placed, looking for any signs of irritation or breakdown. Site should be clean, dry, and free of hair. Rotate application sites. Administer medication by removing new patch from its protective covering. Write your initials and the date and time of administration on the label side of the patch. Remove the covering on the patch without touching the medicated surface. Apply the patch to the patient's skin. Use the palm of your hand to press firmly for about 10 seconds. Do not massage. Reposition the patient for comfort as needed and maintain safe environment. remove gloves, and perform hand hygiene. Record all medications administered per facility policy, including pre-administration assessment data. Evaluate the patient's response to the medication within an appropriate time frame and document per facility policy.
Are you doing okay?
I'm doing good. Maintain proper body mechanics throughout the procedure and maintain patient safety during the procedure as well.